Good. Governor,
With
good
our Lieutenant
afternoon.
Governor and Tom from our Health Department on the COVID issues that'll be available for some answers, some questions that of the material that I'll go over first, and then I'll hand it over to our Lieutenant Governor, and then we'll open up to any questions that anybody has. First and foremost, happy holidays, Merry Christmas to everybody out there, and thank you for being here at this last press conference last scheduled press conference anyways, before Christmas. I want to start today by recognizing that Rhode Island is witnessing a heartbreaking milestone in our ongoing fight against the COVID-19 pandemic. 3,000 Rhode Islanders have lost their lives due to the virus. That is 3,000 mothers, dads, brothers, sisters, sons, daughters, grandparents, friends, and neighbors who will be missed, especially during this holiday season. This is a moment that we will not forget, and one that I hope will serve as a call to action to save countless more lives as we continue through this pandemic. Unlike when the pandemic started, we have the tools to keep ourselves and our loved ones safe. Get vaccinated, please, and get your booster. And although the death rate has slowed down, one life lost is one too many. The time now and every day counts. In honor of the 3,000 Rhode Islanders who have lost their lives, we will be lighting the State House blue and gold tonight in their memory. And following this press conference, I will be directing flags across Rhode Island to be lowered. We know that President Biden will be making some announcements shortly, and my team has already been in touch with the White House today, and we will continue to work closely with them to ensure Rhode Island gets the support that we need. On testing and vaccination capacity, I want to address the work that our team is doing to expand testing and vaccination capacity in Rhode Island. Tom's here today representing a whole team of people that have been working around the clock in a way to address each and every change in terms of the COVID that it comes up. And I want to thank Tom for that, and also the Department of Health and all the related resources that Tom can explain that we'll be using to address this testing and vaccination capacity. I'd like to remind everyone that we were in a ramp down strategy just before Thanksgiving. Things changed, and as a result of that, we're changing again, and I've made it clear that our whole government COVID response team, priority number one is make sure that the testing and vaccination continues to lead the country in that category. We have, like I said, Tom is here with today. He's been working on these issues. Let's start with testing. I want to give Rhode Islanders an idea of where we are. Rhode Island continues to test at rates that are highest in the country. Higher than 48 other states at the moment, and we are currently testing about 10% more than our peak last year. To give you a sense of the scale on some days, Rhode Island is doing more than 20,000 tests a day. That includes K through 12 in our schools, at pharmacies, and across our state at both local and test sites. That's why we set a goal to expand our testing infrastructure by 50%. We're expanding capacity beyond what it was last year. And I also would like to say, look, last year, we compare last year and this year, there was higher infection rates last year than there were this year. But in ramping up to meet the need, and we want to encourage people to get their testing, and we'll meet that demand. So here's an update on our progress. Yesterday, we opened a new rapid test site at Chapel View Shopping Center in Cranston. The site will be open 7 days a week for rapid testing, and to make an appointment, you can visit portal.ri.gov. That's portal.ri.gov. And we will be opening additional new rapid testing sites in the next couple weeks. As we announced yesterday, we are expanding access to rapid testing at 6 existing sites for Rhode Islanders to get tested who are asymptomatic but are looking for a test before the holidays. These 6 sites are located in the Barrington Shopping Center, the Blackstone Valley Community Health, Cranston Parkade Storefront, Rhode Island Convention Center Ticket Booth, Smithfield VFW, and the Warwick Shopping Plaza. Testing is also available for symptomatic people at these locations as well. Here's what's next. We are currently onboarding an additional laboratory to process PCR tests and reduce turnaround times. This will give us the ability to process an additional 5,000 PCR tests per week. And to ensure the highest level of preparedness, we are planning to further expand lab capacity with another company. Having multiple vendors here is important, especially in the case that one vendor has an equipment and staffing issue. Staffing is clearly one of the most challenging issues right now, as we know, not only in the hospitals, but around the healthcare industry and beyond. And that seems to be the one that we really need to figure out. But staffing is causing a great deal of pressure on the services that we know that we need to provide and will continue to provide. So we're going to continue to double down our at-home rapid test strategy. We've distributed all of the 100,000 rapid tests that we announced last week. These initial tests were targeted toward hard-hit communities where individuals may be to pay out of pocket for rapid testings for the families. They may not be able to pay for those rapid testings. We have good news on the 1 million additional rapid tests that we requested from FEMA. Our team in the Department of Health has obtained purchase orders to these tests, and they are currently working with the vendor to secure delivery dates. Our goal is to distribute 1 million at-home tests by the end of January. And we will continue to make 1 million at-home test kits available monthly through at least March. We will be distributing these tests to all 39 cities and towns through municipalities and community-based organizations. In addition to testing, we're also expanding our capacity to get shots in the arms, especially booster shots. This week, we extended operations at both Saconaset Crossroad and East Providence vaccination sites at least through the end of December. We're also working to open 2 additional mass vaccination sites. And we're moving full steam ahead on expanding our vaccination capacity by once again partnering with our cities and towns. And I want to make it clear that the cities and towns were great partners when we were trying to ratchet up our vaccinations during the spring and the summer. And I've met with them. We have an additional meeting this afternoon, and we fully expect that people will have the option to get their booster shot locally, as one of my family members did in East Providence this weekend. So our message continues to be the Rhode Islanders is that the work continues. We want to make sure that we're flexible in terms of responding to the challenges that we don't know what are around the corner, but we're definitely working to be up to the task, and I believe that we are. So please, what you can do is get vaccinated if you haven't already been vaccinated, and get the booster shot if you already have got vaccinated. Part of that work, which has been ongoing with the health department and partnering with with our office, is the 401 Health app. In case you missed it yesterday, in collaboration with the Department of Health, we launched the 401 Health app. Before I came on board here today on this conference, I was told that there's been 3,500 downloads already on that app. So thank you for downloading. We encourage you to download this information as well. It's good for our preparation and to be prepared on what we're dealing with right now, but also what might be coming down around the corner that we don't know what to expect, but we will be prepared. It's meant to be an easy, convenient, and secure way to store your and your family's digital COVID-19 vaccination records with just the touch of a button. We joined 8 states, including Connecticut, just announced, and Massachusetts will be rolling out their version soon. Many of the countries and pharmacies across the state who are offering the smart health card technology. You can download your 401 Health app in the Apple App Store or the Google Play Store right now. I was able to do mine this morning. And if you don't see your booster record right away, it's there. Just swipe to the right. Swipe to the right. One of our most critical issues that we're dealing with right now is hospital staffing. And as I said last week, you've heard from doctors themselves, our hospital systems, like hospital systems around the country, are experiencing enormous pressures due to staffing challenges, rising COVID cases, some burnout from the staff as understandably, and of course regular emergency situations. This is exactly why I put in place mitigation measures like masking and proof of vaccination last week. Additionally, as I mentioned last week, we have partnered with our hospital system to request FEMA personnel to deploy to Rhode Island to assist in our hospitals. And we're awaiting word on our request to FEMA. Let me tell you some of the additional steps that we are taking to address this issue. My team is in conversations with General Callahan. I spoke to him as recently as about an hour before this meeting to explore National Guard troops in our hospitals to assist with non-medical administrative functions which could alleviate stresses on nurses, CNAs, and other medical professionals. If someone holds a valid license in another state and wants to come to work in a hospital in Rhode Island, we will begin granting them a temporary license immediately. We have been doing this for nurses since the start of the pandemic, but yesterday we expanded this for other professionals working in hospitals. We are also expediting the CNA licensing process, and we have launched a broad communications campaign in partnership with the hospitals to educate the public about when to go and when not to go to the emergency rooms. Use your primary doctor, use your local emergency clinics. That's an option to give some relief to the doctors and the nurses and the personnel at our hospitals. The state police are also working on implementing a statewide system of emergency medical dispatching, which will coordinate with EMS statewide on the E911 system. So before I turn things over to our Lieutenant Governor, I want to make an important announcement for Rhode Islanders who are struggling to pay their bills this winter. Rhode Island has received over $21 million for the federal low-income home energy assistance program known as LIHEAP. This funding will help renters or homeowners pay heating bills or respond to a home heating crisis like the heat shutoffs. That $21 million on top of the $30 million in American Rescue Plan Act funding for this program. And as we've mentioned many times, this in Providence CCRI campus, our office, along with the Rhode Island Housing, partnered in last week with a sign up. The Lieutenant Governor was there as well with us to continue to work on that rent relief program, which we're approaching almost $90 million of distribution, and our goal is to distribute $200 million between now and September, the end of September 2022. We're also announcing another federal program that will help Rhode Islanders pay the cost of water and wastewater bills. It's called the Low Income Household Water Assistance Program. It offers one-time payments up to $500. It will begin in early 2022. More details on that will be made available in the near future. These grants will be administered through the Community Action Program agencies across Rhode Island, and we thank them for their leadership. Our CAP programs have been instrumental during the time frame since COVID started and before then, but in particular during this time frame. Our office will be issuing a press release shortly with more details on the application and eligibility process. We're in the winter months, and we want to do everything we can to prevent shutoffs and help low-income Rhode Islanders pay their water and heating bills. So these announcements are very important, lengthy announcements, but important. So I urge you, if you're eligible or you think you're eligible, to apply for this assistance and help us spread the word to those who may need a little extra support this holiday season. The more dollars that we get circulated into our communities, the more it helps the individuals that need it, but also helps our local economy because you're circulating dollars that we're holding on to because we have to hear from you so that we can distribute these dollars. So I encourage you to apply. A short update on the Eleanor Slater Hospital. The Joint Commission informed Director Charest today that it has awarded Eleanor Slater Hospital a status of accreditation. This is a change from the status the Joint Commission announced earlier this year following its June survey, which was an accredited with follow-up survey. Again, credit to the director, the staff, and everybody that's been involved with this very tedious but important process of catching up and correcting some pre-existing issues. So Director Charest, thank you, and thank you to all the staff that has worked on this. Based on the hospital's demonstrated progress, the Joint Commission has granted the status of accreditation with an expiration date of June 19, 2024. With that, I'll turn it over to our Lieutenant Governor and be available for questions along with Tom McCarthy.
Thank you, Governor. I know that you have a lot of questions, especially regarding the vaccine and the testing, but a few things that I would like to touch on before turning it back to the Governor. I want once again to thank the Governor for his leadership in addressing the housing situations and addressing the homelessness challenges that we're having right now during the winter time. The Governor has been working to make sure that we can find a solution that is permanent, that is not just something that we're going to deal with this year and coming back next year to the same situation. He has been working on this for a long time and has been able to come up with solutions to address the problem at hand right now and continue to work to make sure that we have a plan that's going to be sustainable moving forward year after year. One of the things that we have learned through the working in the Lunch and Learns about housing is that the homelessness problem that we see outside is just the tip of the iceberg, but there's so much happening below. And there are so many individuals that are about to become homelessness that are either sleeping in couch to couch or are staying in a hotel. So there's so much that have to be done to address that problem, and that's why the approach that we're using, that we're following, is to find solutions that are going to be lasting. And as Governor McKee said, we're going to overbill for the homeless shelter bed to be available. So thank you for that work. This announcement that the Governor just made right now about the assistance for the light heat, this is very important because one of the things that my office has been finding is individuals have been calling about the rent relief help And right now, rent relief is only available for renters. So renters can apply also for assistance to pay their utility bills, but the homeowners are not, do not qualify for the rent relief funding. So with this funding right now, homeowners, if you are a homeowner, you're able to apply for assistance to be able to pay your bills through this program. Also, yesterday, the governor, together with the Secretary of the Department of Health and Human Services, Secretary Jones, announced a $3.6 million for the CARE Act funding that is going into early intervention, and this is going to help provide support to Rhode Island children. It's something that we've been trying to find more resources to help. We have the challenges of the child care. We hear the calls from the different stakeholders that are concerned about the challenges that they have and how we have to improve the services and resources in the child care. So I want to thank the governor also for allocating that funding, making sure that we are helping to ensure that individuals are able to have their kids in a child care so they can get back to work. If we don't have child care, we cannot be available to work. And that continues to compile in the problems that we're facing right now with the shortage of workforce. So as you can see, we have been working really hard. It has been amazing experience, and I feel very fortunate to have this opportunity to work on behalf of the state of Rhode Island and all of the residents of the state of Rhode Island, together with the governor, having a front row seat to how the decisions are being made and how the challenges are being addressed. So I want to thank you for this opportunity, for this blessing to serve you. And with that, I'm going to turn it over back to the governor because I know you have a lot of questions.
Great, we're going to start right here. Governor, 2 questions related to the Smart Health card. You mentioned swiping right for the booster shot. Thanks for mentioning that. Wanted to ask you specifically if there is any, wanted to ask specifically if there's any kind of glitch on that app that people have experienced so far, and how many, you said that there were a couple thousand that had downloaded that today. Are those new downloads because it was an upgrade to the previous Crush COVID app?
Right, so the Crush COVID, the base there stayed, and then they should go on, though, I believe, right? They should go on, Andrea, and update it. But the 3,500 was, I was just told before I came over here, that was the count that is since the app opened up. So that's a good progress.
Now, people that maybe have gotten their vaccinations out of state, we've seen some people that those are not showing up for. Maybe they've gotten a booster in Rhode Island and those are showing up. Any ideas on how to address that? Maybe that's a question for you, Tom McCarthy.
Yeah. Tom, jump in, please.
Yeah, so, one of the challenges we've had is there's no national vaccine record database. So what we've tried to do is at least standardize the proof of vaccination. So if you don't have your card, this digital proof of vaccination will work across the country and internationally. So what you can do is, and we'll push the information out after this, but on our website, if you provide your proof of vaccination from out of state, or if you're a veteran and you received it through the Department of Defense, we'll add you to the Rhode Island database so that you can use this. But currently now, this captures everyone that's been vaccinated in Rhode Island and is in the Rhode Island database, so you'd have to be added.
All right, Brian?
Governor, what is the holdup with bringing in the National Guard? Massachusetts is doing it. I know you made your request to FEMA, but that doesn't seem to be anything imminent. Wouldn't the National Guard be an immediate help in the hospital?
Yeah, so we announced the FEMA application last week. We had also projected a time frame the first couple weeks of January. In conversations with the general today, I think that all options are open. I think that Massachusetts just made that announcement this morning. So, and we'll get the details of what they're doing. But our National Guard has stepped up in every situation. We talked about testing and also vaccination. We got them back in the loop on that as well. And we'll find what the capacity is, but all options are on the table, and that was the message that I asked the general today, well, how I should answer that question. that would be asked is that all options are available on the table, and we'll continue the conversations with them on an immediate basis.
And I know you mentioned expanding the rapid testing with the added site in Cranston, and distributing the home test by the end of January. I think there's a lot of people who are trying to get tested this week for holiday gatherings. What do you say to the people who just can't get an appointment, can't get a home test, and are trying to take that step to have a safe gathering?
Let Tom answer that in terms of capacity so he can give people the correct information.
Sure. Yeah, I think a couple of things to be aware of. So, obviously over the last couple of weeks, that the outlook has changed pretty significantly. And no doubt, I know that the president is actually probably speaking to it right now. The Omicron variant is presenting a unique challenge. And there's definitely going to be some challenges ahead in January and February. So with that, I think people should kind of reassess their risk when they're looking to go to holiday gatherings. We know Omicron is in Rhode Island. We know it represents about 73% of the new cases nationally, not quite there yet in Rhode Island that we've observed, but we know it's coming. And we know it has an impact on the protection from symptomatic infection, even if you're fully vaccinated, even if you have a booster. So I think people should continue to do the things that we know that work, get tested if you can, and it's a finite resource. There's only so many tests and only so many appointments. Make sure you're vaccinated, make sure you're boosted. If you're at high risk, maybe you reassess your plans. But layering all those things is going to be critical. Mask wearing, everything we've talked about in the past. With regards to testing, so we want to make sure testing is as available and as accessible as possible ahead of the holidays and in light of all things Omicron. So as the governor shared, we're doing more testing now than we ever have in the past. And there's a couple of things that I wanted to talk about. One, those rapid tests give you results that day within a couple of hours. So you have a sense with a pretty high degree of confidence, if you're carrying or have COVID at the time. PCR is the gold standard, but the rapid antigen is a great test as well. With the PCR test, as I shared last week, the challenge we're running into now is we have maxed out all of our lab capacity locally. And there's one very specific reason why. I'll talk really quickly about why we're there, but more importantly, what we're doing about it. From a response perspective, what we've been asked to do, what we've been focused on, is first and foremost keeping Rhode Islanders alive and keeping them out of the hospital, and keeping students in school safely, and keeping businesses open safely. So with that, we prioritize our long-term care and our congregate care settings, then our K through 12, our school, our students, and our staff, and then the rest of the Rhode Islanders like you and I. So with that, we found as Delta has continued to impact us over the winter that we have over 100 congregate care settings that are in kind of an outbreak response protocol, which is far more rigorous testing. And we know from our experience last year, those are some of our most vulnerable Rhode Islanders. So with our PCR tests, we've been prioritizing the results, so all of those are coming back in less than 2 days. Next is K through 12. Those are somewhere usually between 2 and 4 days. And for everyone else right now, it's about 3 to 5 with some outliers. The bottom line is that we have to get those back down. So as the governor shared, we're doing a few things to further expand testing. You're going to see more sites, more availability of rapid tests at all of our sites, and then those at-home kits that we can distribute to people, while we also bring on additional labs so that we can vastly expand our PCR capability and ensure that we're getting them back to everyone in less than 2 days.
On the at-home tests, if somebody tests positive on the at-home test, what should they do? Because they're not in the system, so to speak, as you would normally be if you're tested at a site. So what should you do, and what's kind of the protocol, and how do you keep track of those people?
Yeah, we have an intake process, and we'll have to get you the details afterwards here, but there's a phone number that you can call, notify us that you're positive, and then we'll connect you with our case investigation and contact tracing. And you'll go through the standard protocol at that point. But as always, if you test positive, begin to isolate, and then we'll make sure that we get that phone number out after this.
Thanks. Governor, the nursing home industry came out yesterday and said that they're dealing with thousands of staffing shortages, and that the new staffing requirements that are going to go into place at the beginning of the year is going to make matters worse. So they're asking for a one-year moratorium on those requirements. Is that something you would support?
Yeah, and I've had the same conversations, meeting with the nursing home associations, and I know that that's one of their requests. I think that from a practical point of view, as I've said, there's three big issues that we're dealing with: staffing, staffing, and staffing. And in the healthcare area, it clearly is that space. So we would look at any options and work with the General Assembly leadership on developing those options. And that's certainly a discussion that we expect to continue with the healthcare, the nursing homes, as well as the leadership in the General Assembly.
Thank you. Steve?
Governor, two things, if I may. The first is you mentioned opening two mass vaccination sites. Are these the same sites that were slated for closure at Saconaset and East Providence?
Yeah, I'll let Tom answer that one. He's got the logistics, but East Providence is staying open. When we were suggesting that might close when we were on the ramp down mode. Saconaset was scheduled to close, but we kept that open, and we're negotiating right now with the property owners. I believe that Middletown is going to be activated. You might want to just speak to that.
Sure,
Tom.
absolutely, Governor. Yeah, so as the governor shared, so Saconaset, we're still vaccinating there this week, and the plan is to even further expand operations there when we're looking at testing and treatment. Also looking in Providence, potentially the convention center, and then over on Aquidneck Island in Middletown at the Bennies, the famous landmark there. So one of the kind of another key piece of context there is right now, we've boosted about 44% of Rhode Islanders that are eligible. So we know there's about 340,000 that are eligible today. We want to expand that capacity as quickly as we can to get them boosted.
And the second part, if I might, Governor, as far as activating the National Guard, is that a matter of money? You lack the funding to bring them on board, to put them in the hospitals, or have the hospitals resisted bringing Guards people into their facilities?
No, we're working our way through that right now. We want to make sure that we know if we activate, that we do it in a way that there's reimbursement coming. That's not delaying the conversation. I think what it is that we're reacting very quickly to a moving target. And so everything is on the table. And as you can see, a great deal has happened even since last week when we announced the mask protocols, right? So, and we're certainly managing that as well. So we've got everything on the table, and any resource that we can possibly use that makes sense logistically. The finance is really not immaterial to it, to tell you the truth. It's logistically, if it works, to create higher levels of safety as we, work through this this unknown territory, right? As I've mentioned, and Tom just mentioned, we're up to 42. You said 42% of the eligible people on the boosters. We got the National Guard working on that right now. So they're activated to the degree that we believe is in the best interest of the state of Rhode Island, and really finances is not going to deter us from providing services that make sense. Yeah, it could go there, but again, just from a logistic point of view, many of the healthcare workers that might be in the National Guard are working in the healthcare system. So that if you actually pull them from one site to another site, you gotta zero-sum game there, right? So I think that we gotta focus and analyze what the value is of that personnel, and we're in the process of doing that right now. As I mentioned, I did ask the general how I should answer that question today, about 2 hours ago. So that's how everything's on the table.
Right over here.
Now, a question for Tom. I know you talked a lot about testing, very thorough response, but there's some people who are still waiting for those turnaround times in terms of results. Some are even pushing a week. That we received some messages from people. I guess what would you say to those people who are, very anxiously waiting for those results, especially with the holidays this week?
Yeah, absolutely. So what I would say is it's important to make sure that we're kind of leveraging the right test for the right time. So if you're asymptomatic and just want to check and see that extra layer of caution before you go visit someone, get a rapid test. You'll get a quick turnaround there. We know for many instances, though, perhaps to return to school or return to work, you need that PCR result. We are trying to work through that backlog as quickly as we possibly can, but we really need these additional labs before we can do that, and that's going to take us a couple of weeks. So we're getting some additional capacity out of state that should make our program more resilient. I think the other piece here too is right now it's about 83% of results that are coming in in under 3 days, but we know there are far too many Rhode Islanders that are stretching out to that 4 to 5. So now, especially where we are with Omicron, if you're unsure, if you're symptomatic, reassess your risk and think about what you're going to do, over the holidays here. The good news is if you're symptomatic and you're getting tested, you're also getting, a rapid result that should give you some kind of indication right away.
Any ballpark as to when those labs will be available? I know you said a few weeks. I don't know if you have it.
I'm doing everything I can to get them to start accepting samples. I would love to see it this week. I think, by the beginning of January, first week in January, we're going to see our turnaround times come down. I'm working 24 hours a day to make that happen sooner.
Thank you. John?
Governor, good afternoon. Merry Christmas to you, the Lieutenant Governor, and Mr. McCarthy. Governor McKee, Governor Baker today announced in Massachusetts it's a mask advisory. And Connecticut, they also have the mask advisory. So Rhode Island is an outlier where the northern part of our state has a mask mandate, and they feel that their workers have to act as like the mask or vax police. Why is it that Massachusetts has a mask advisory, but you have the mandate?
Well, every state has its own circumstances. I think that it was pretty clear that at that press conference the other day that there was the hospitals to every single one of them. I was on a call this weekend about other issues that the hospitals are asking us to consider. So the hospitals were in unison asking for that, as well as the Medical Association in the state of Rhode Island. I think that we've compromised a good spot that time will tell, but I think that I feel bad that the Georgetown game was canceled because of the COVID issue for tomorrow night. I was very hopeful that we would show that, as working with the dunk, that the people in attendance there would be wearing masks. So, look, it's a 30-day strategy. It's going to expire on, if I don't continue it on January 18th. I don't think we're asking anything over and above what is in the best interest of the state of Rhode Island. And we'll work with those in those few instances where they believe that they have customers that are not behaving properly. We've asked everybody to post up, what their each business or each facility is calling on, whether they're looking at vaccine only, like the PPAC has, or whether they have a strategy. These are under 250, I think, that you're talking about, or whether they're doing a combination. Look, if you're vaccinated, you can come in and you can wear a mask, not wear a mask. That's pretty flexible. If you're unvaccinated, we're asking you to step up again during this time frame as we try to get on top of what's going to happen on the variant. Right now, we're fortunate, as Tom said. I think that one coming here today, I think that the number was three of the new variant in the state of Rhode Island. I do think that our vaccinations and our behavior has put Rhode Island in a spot where it has led the country during Delta on the key pieces that are important to the health of the state of Rhode Island. And I think that what's in front of what's being asked right now of our local businesses has given them the flexibility to overcome many of the issues that I was fully aware of as Lieutenant Governor that was restricting them to a level where they couldn't operate. So our gyms, our dance studios, and others that are in that category, there's a great deal of flexibility. So all I can say is, look, you're not going to satisfy the two extremes that want us to shut down the economy, or the extreme that just have us do nothing. So I think that we've had a good medium here, and we're going to work our way through to accommodate as many of the issues that might come up over the next couple of weeks. We're available. If something comes up, we want to hear from them, and if we can kind of smooth that over, we will.
We're going to try to get to everyone in these last couple of minutes. Alexa?
Yep, so AARP Rhode Island sent you a letter asking for the booster rollout to prioritize older adults. Did you receive the letter, either the governor or Tom? And can you tell us kind of how the booster rollout is doing in terms of vulnerable
Well, I'll make my
residents?
quick comment on that, and I'll let Tom verify that, because there's a question I asked him this morning. There's no need to prioritize anyone. We have the inventory. We got the ability to get people vaccinated. We need to build out the capacity, as Tom has said. So I haven't directly read that letter, but I would say that the AARP, look, there's enough supply to have everyone in the state of Rhode Island who is being is eligible, based on the standards of the fully vaccinated, to get vaccinated as quickly as they can. So there's no need to prioritize, and I think the question is a good question, because we did prioritize last year at this time into age groups, into other factors, but I'll let Tom finish that up. But I think that he reinforced, and that's actually the question I asked you about 2 hours ago, Tom. I think the exact same question. So
That's right, Governor. Thank you. Yeah, so with regards to, last year, we didn't have enough vaccine in the state. I think the big thing right now is we have been ordering above what our authorization was through the federal government. They've been great partners, so we're getting about double each week. Now we're just trying to make sure we have enough people to actually do the vaccinations. But with regards to older Rhode Islanders, throughout the response, we've always prioritized our most vulnerable. We know some of our older Rhode Islanders kind of fall in that category. They were the first that were eligible for the booster. We held clinics at all of our nursing homes, long-term care facilities, and congregate care. And then last week, we called every single one where they had lower vaccination rates and offered to come out and do clinics again. So ready and willing to continue to do that.
And I just add, too, as a point of information for the people listening, that that's one of the reasons that we've really now reached out, reactivated municipal leaders so that, and municipal EMTs and firefighters, in a way where seniors will feel comfortable in many ways getting vaccinated close to their home. So we're going to make that as available as can. Right now, we would go to vaccinateri.org. Is that the site, Tom?
That's right, Go.
Vaccinateri.org, and they can create an appointment in the on the options that are available.
This is a question probably best directed to Tom McCarthy. I understand that the state and the federal government are both making a big push to send out at-home tests, rapid antigen tests, and so forth. But I've been hearing from a number of medical professionals, including at least one who had a senior role with the state in the past, expressing concern that we are not really aware of the scope of the problem, suggesting the possibility that there may be between 2 and 10 times as many people with active COVID infections as we've been able to count and measure. And I can't obviously vouch for that, but my question is, do we have a concern that as we change the mode of testing, we go more toward rapid antigen tests, at-home tests, at-business tests, and so on, that we will lose the ability to measure the rate spread of infection and even to detect things like new variants or the prevalence of variants?
Yeah, that's a great question. And, this is something that the team's been looking at for some time because we knew at-home tests, are going to be a part of the strategy moving forward. It was kind of a matter of when. And I think some of the initial concern was exactly, that point, having a very clear sense of who was actually positive, and especially when we're talking about mitigating spread, ensuring they're isolating and quarantining, and quickly connecting them with treatment. I think as things have evolved, we have a couple of different opportunities here. One is ensuring that there's accessibility. We're running into this right now. There's a hard and fast limit on how many people you can test at our physical infrastructure. So having a test is better than no test, far and away. The other piece is making sure that process is easy and seamless for people that do test positive. If you test negative, we'd love to know too, to help us understand the bigger picture, but make them report it in. And then also working with schools, businesses, clubs, sports organizations to have testing programs on their locations. And we have some fantastic partners in the business space. So with all of this and a fantastic data team, both at the state and in partnership with Brown, we're confident that we'll still have a really robust surveillance program to help us understand where is the virus, what is it doing, and what do we need to do to stay in front of it.
Do you have any concerns about the accuracy of rapid antigen tests relative to PCR tests? In particular, are you confident that rapid antigen tests will not produce an unacceptable level of false negative results for people who are particularly symptomatic?
Sure, that's another great question. And again, the PCR is the gold standard, right? But in the appropriate settings, the rapid antigen is a great tool as well. And again, a test is better than no test. There's a difference if you're symptomatic. If it's positive, you can be fairly confident that that result is positive. That's why in that workflow today at our testing sites, if you're symptomatic, you'll get a rapid, but you also get a confirmatory PCR. When we're talking about someone that's asymptomatic and you're just trying to see if it's safe for you to gather, things like that, rapid antigen is a great tool. And a way that you can achieve a higher accuracy is, more than one test over a couple of days here. So I think it's important for us to not let perfection get in the way. We need to really start integrating all of the different tools through that layered approach to make sure, we have the most effective approach.
Got Ray over here, and then Pat will have the last question.
Okay, it sounds so beautiful what you guys are saying here, but it's not contact tracing. For the past 3 weeks, my family is getting sick with COVID. All my cousins got COVID. Nobody got a phone call. What are we going to do for contact tracing? Second, what's the Spanish translation? You got to speak Spanish, Sabina, because the community is getting affected. I mean, you can do all the tests you want. It's not going to work if you don't tell people somebody tests positive. Contact tracing worked before. You had to activate it. I'm still waiting for 10 days for an answer from the Department of Health, from the governor's office, and nobody's saying anything. What's going on?
Yeah, so we have a very robust contact tracing team. They've continued just as they have throughout the pandemic. I think another thing, though, again, as we're talking about the number of cases that we're seeing today, is that we have to prioritize. So when we're talking about the very detailed case investigations, it's in those at-risk settings, those Rhode Islanders that are at higher risk because they have underlying conditions or they're unvaccinated. But if you test positive, because you get a notification from us on your test result, and then you're followed up with by a contact tracer. But I'd love to catch up with you after and understand specifically what instance you're talking about.
Well, one of my family members passed last week, and the other one is in the hospital, in intensive care unit, and nobody got a call.
Okay.
He's sick.
Ray, let's have you follow up with the Department of Health.
I'm still waiting for you guys for that. Sabina, say something in Spanish, because the community is waiting
So-
for an answer.
Yes, I just want to, we normally have translation available on this press conference, so it's being translated as they speak. Normally, it's happening, so I can. No, I don't mind saying something in Spanish, and I think that I bring that, but I just wanted to let you know that translation is provided for this conference. Queremos recordarle a toda la comunidad que el COVID está aquí. Tenemos dos variantes que son muy fuertes, el Delta y el Omicron. Queremos asegurarnos que usted tome las precauciones necesarias para que su familia esté segura. Si usted tiene algún síntoma, se siente que tiene algún síntoma que cree que sea una gripe, no tome el riesgo de llevarlo a sus familiares. Así que quédese mejor en su casa, hágase una prueba rápida para saber si es COVID, sí o no. Y si aún así la prueba rápida y usted tiene síntomas, es negativa, evite el encontrarse con sus familias en estos días y evitar que pueda tal vez causar que alguien en su familia se contagie de COVID.
Governor, it was a wonderful, actually a blessed day last week when the state of Rhode Island finally came to the table with significant funds to help the homeless. And of course, when you hear about the expansion of programs like RIHEAP and this new proposed water bill for those less fortunate, one can only smile that their needs are being attended to. But for those folks in the middle class who did not seek the warm embrace of state government, for whom there seems to be never any consequences, or took the dreadful step of having a private business, who have now become the front line, as Mr. Petro said, the arbiters of all things on a chaotic, confusing Byzantine mask semi-mandate. What are you doing for them? And because they're the ones that are actually getting squeezed without any sort of assistance by high housing costs. They're the ones who have no one to go to when their small businesses are being crushed. They have nowhere to go, and yet the state government continues to hold on to $1 billion, which I can only assume they're figuring out who the privileged few are going to get doled out to. What is the government going to do to lighten up on folks?
Yeah, so first of all, we haven't seen the results of the way that the public and the business community has responded in a very positive way. throughout this whole process. There's no one who's advocated more for the small businesses during the time I was lieutenant governor and continue to do so. $30 million we found that went out to our small businesses in the spring. The request right now shows, I think, almost $35 million that's going to go into the business community, small business community, once the General Assembly approves. So we will continue to assist the small businesses, including we're preparing now, which I'm headed to a 2-hour budget, daily budget review, where we will have an article for the small business friendliness that the state has never seen before, and we'll continue to do our work and continue to work with those who are willing to work with us. And I think you're going to be surprised the fact that there is buy-in here, because, as I said, there's, in my fantasy basketball, which I still work with the kids that I coached years ago, I had 7 players that couldn't play this weekend because of postponed games. The fact of the matter is that that around the country, and to a lesser degree in Rhode Island right now, we're getting impacted by the surge of the COVID. And you can just see that, as I mentioned, with the Georgetown cancellation, the Brown URI game. It's front and center. We're dealing with something that is, it's very, very important. The advice my wife gave me when I went to an event on Saturday night was be careful. There's a virus out there. And that message is one that we take very seriously, and that's why we're here today to bring Tom forward and the work that is being done to address the issue, and that issue in terms of the EO that I signed relative to the masking is a good possibility, compromise to help our small businesses, and it clearly states in the EO that we took in consideration the small business community. We'll continue to do that.